During manual resuscitation, patients receive rescue breaths via a bag valve mask. For adults, the recommended respiratory rate is about 10 breaths per minute with tidal volume sufficient to create chest rise. For the average adult, a standard breath is approximately 500 milliliters or less of air. When patients receive too much air too fast during manual resuscitation, it is called hyperventilation. Studies show that it is happening at alarming rates, 60% or more of the time. That's more often than it's not happening, and it causes a significant decrease in the chance of survival. Those that do survive may suffer from the lung trauma, aspiration pneumonia, or neurological damage caused by hyperventilation. When a patient is hyperventilated, there is a decreased opportunity for the exhalation of gases. Remember, there is a limited amount of space in the chest cavity, and the ribs are fixed in place. So when the lungs continue to fill like a balloon, they take up more and more of the limited space available. This creates less and less space for the heart to refill with blood and pump it out to the body. Therefore, the heart's output of oxygenated blood decreases and blood pressure drops, along with the chance of survival. Comparative animal studies showed more than a 70% decrease in the chance of survival with hyperventilation. But those who don't die may still suffer from the lung trauma associated with being hyperventilated. This includes overinflating the lung until it pops, known as pneumothorax. It can also damage the delicate lung tissue, causing acute respiratory distress syndrome. That's also called ARDS. This often results in prolonged mechanical ventilation and decreased chance of survival post-initial cardiac arrest. Hyperventilation can also cause gastric insufflation. That's when air gets pushed down into the stomach, causing it to inflate. This can result in vomiting stomach contents, which can then be aspirated. This further complicates matters by worsening ARDS and creating the very real potential of aspiration pneumonia. Both are related to increased hospital stays and decreased out-of-hospital survival. Hyperventilation during resuscitation can also cause brain damage. Excess CO2 in the system causes blood vessels in the brain to constrict, and there is less oxygenated blood being transported to the brain. The brain gets starved of oxygen and cells begin to die, resulting in permanent neurological damage. Hyperventilation during resuscitation causes terrible outcomes. In the adrenaline-filled situations in which bag valve masks are used, there is nothing preventing it.